And we're going to start off with two presenters working in the disability sector from Down Syndrome South Africa and from Shona Quip. And after that, we'll have four presentations of people working in the peer-led GPI sector on parenting programs. So I'm going to hand over now to the first speaker, which is Elaine Passmore from Down Syndrome South Africa. Thank you.
Thank you very much for this opportunity. My name is Elaine Passmore. As was stated, I'm from Down Syndrome South Africa, and we are the umbrella body, the national body of organizations of persons with Down syndrome in South Africa. Next slide, please. Okay, so just a brief overview of who Down Syndrome South Africa is, who we are. So in the 70s and 80s, different parent groups, support groups were formed, and they realized there was a need for a national body. And so DSSA was started in 1986. We're the umbrella body to, it's actually 13 associations, support groups, and outreach groups throughout South Africa currently. And we celebrate two key awareness days. This is on the 21st of March, which is World Down Syndrome Day. And then on the 20th of October, we celebrate National Down Syndrome Awareness Day. Next slide. All right, so our associations, we have a Down Syndrome Association in Amatoli, Free State, we've got KZN Support, we've got Down Syndrome PE, we've got Support Cape in the Western Cape, we've got Down Syndrome Association of Pretoria, Tshwane, we've got Down Syndrome Association of Western Cape, so we've got two in Cape Town, and then our outreach and support groups are Polokwane, Potchefstroom, Kimberley, Witbank, and Mafeking. So the key focus areas that we as a national body focus on include establishing the outreach and support groups in areas that are needed. We do capacity building of all our members. We're empowering persons with Down syndrome and their families through workshops, awareness events, and sharing of updated information. We've got a national self-advocacy group. And actually in October, we are so proud that our self-advocates had and ran their own webinar. They ran their own webinar creating awareness about Down syndrome. Our other focus areas are we advocate on human rights, we collaborate with different government departments, and we encourage change in policies to ensure implementation of all legal policies and international governance on the UNCRPD. Next. Okay, and then we develop programs and resources that are beneficial to persons with Down syndrome and their families. So that's a little bit about who we are. The mission of DSSA is that we are committed to finding ways to improve the quality of life of all persons with Down syndrome and other developmental delays, promoting that they have the right to live with independence, dignity, and security as valued adults and full citizens in society. So it is so important to ensure that any programs that are out there, that they do include disability and disability awareness. And the reason, I mean, all the mainstream parenting resources do not have a little section or they exclude disability. It's important to have tailored content in accessible formats and include parents with disability. It's so vital to ensure that we that any programs are accessible for parents and even persons with disabilities. The key contents areas that should be include new parent support. So I'm just going to touch a little bit on why we need these different content areas. So for new parent support, when parents find out that their child has a disability, it's important that they have um, up-to-date information that they can access so that they know the journey that they're going to be on. It's also important that they have access to information that tells them where they can get the support that they need, and any healthcare providers that are around that are uh, knowledgeable in their specific disability areas. Disability specific knowledge. Disabilities are different. It's important to have access to information that is specific to the disability, um, so that the parents have, as I said earlier, up-to-date information. Behavior support. A lot of children, specifically, a lot of children with disabilities can have behavior challenges due to lots of perhaps not being able to communicate, and having the support and the information at the parents' hands can assist them in supporting their child as best as they can. Having information on why it's important to have high expectations. If we have high expectations of our children, they will go so much further. You know, if you teach a child only to count to 10, that's all they're going to be able to count to. Um, we need to ensure that inclusion pathways are included in programs so that people know what inclusive programs or schools are available, age-appropriate information, early intervention, which is vital for all children with disabilities, service navigation, which should include the different, for children with Down syndrome, they need occupational therapists, speech therapists. So having access to the therapists that have specific knowledge on the child with disability is very important. Mental health services, and who has knowledge on supporting the individuals in their specific disabilities, very important. And peer networks. It's very important to be able to connect with your community. Thank you. Next slide. So accessibility for parents with disabilities should include easy to read, um, audio, visual supports. All of this is also very important and very helpful if persons with disabilities are joining. Accessible venues, so they know which venues are accessible for them. Sign language and peer supporters. Next slide, please. So age-appropriate information should include social stories. So specifically children with intellectual disabilities, they learn visually. Children with Down syndrome, very visual learners, strong visual learners. So having visual support, social stories to help them to learn social settings and appropriate social behavior is very helpful and important. Um, uh, Topics such as puberty and consent, so important for our children to learn how to navigate, and for parents to know how to discuss these challenges, or this growing up. Safety, safety on the internet, friendships and independence, also very important. Sorry, next slide, please. Next slide, please.
Elaine, I think that has gone to the next slide.
Okay, thank you.
No. So,
All right. Okay, so inclusion as a parenting skill. So understanding inclusive education. So it should also include the importance of inclusive education for all children, the benefits thereof, not only for the child with disability, but also for their peers. Advocacy. What is advocacy? The importance of advocacy, and supporting learning at home, because it's not just in school that we learn everywhere. High expectations, as I said earlier, parental expectations shape outcomes. And then challenging stigma and overprotection. It's very important that there is support for parents to be able to go to and understand and have someone to lean on. So parents need practical strategies, emotional support. Because parenting in general is can be challenging. And then if you add to it the different challenges that come with raising a child with different abilities, it can be overwhelming at times. Peer networks, community is so important. Right information for parents to understand and know the rights of their child and their rights, and non-judgmental facilitators. Next slide, please. So our recommendations would be always co-design with parents and DPOs, organizations of persons with disabilities, or even including persons with disabilities, such as our self-advocates. Ensure accessibility, include lived experience facilitators. So ensure that anyone who is part of it has some experience. Provide specific modules, rural and low resource adaptations, because if we look at, South Africa specifically, the challenges that we have, is access to information, data, or even just having a smartphone or a laptop or a tablet. We need to ensure that there's access to this information. Father involvement, oftentimes it's always the moms that get access to this and have the support networks, and fathers are left aside. Mental health, as we as we learn every day, mental health, persons with disabilities absolutely do have challenges with mental health. And I think a lot of them even more so than, the typical population, because of the stigma attached to disability, the isolation that is faced. So it's very important to have that access to mental health facilities and just information on health and wellness, and then linked to different family services. So, for example, it would be the different associations for Down syndrome. Okay, next slide. Thank you. So, in conclusion, empowered parents equals thriving children. If you have parents that are empowered and encouraged, they will be encouraging their children and empowering their children. So supported parents equals inclusive communities. If people feel supported, if they feel that they have a community, we have we will have a more inclusive community. Thank you so much for this opportunity.
Thank you, Elaine. And I'm now going to hand over to Awelani Mamburu from Shona Quip. Over to you, Awelani.
Thank you so much. Let me just switch on my camera as well. Can you guys hear me? Hello?
We can't see you yet, but
Can
maybe
you hear
start your
me?
presentation anyway.
Okay.
We could see you earlier, so
I think I have Zooey's problems as well, but if you can hear me, I'm just somewhere gonna start with my presentation. So I am Aulani Mamburu from Shonaqub Social Enterprise. Shonaqub Social Enterprise is an organization that was started about 35 years ago. Uh, and I am going to do this presentation particularly focusing on one of our programs that we call the Parent Network. The Parent Network was started about 5 years ago to address isolation through a national network of connection, support, and advocacy. Next slide, please. So the background of the Parent Network is that, particularly in a country like South Africa, where there is a high unemployment rate, difficulties in accessing healthcare and good quality education. Raising children comes with so many challenges, and these challenges are so much compounded for caregivers and parents of kids with disabilities. And currently, the stats in South Africa says we have just below 700,000 children that are living with disabilities. So the program is called the Parent Network, which was established in 2020. It utilizes WhatsApp to connect parents and caregivers of children with disabilities and covers the whole of South Africa. The caregivers share advice. It's more of a peer-to-peer support network, and we have training opportunities for parents and from professionals. We invite experts that comes and gives training on specific developmental and other challenges that parents of kids with disabilities face on the day-to-day lives. Next slide, please. So some of our key program activities, like I said, is a peer-to-peer support. Parents support one another with information, services, and how to go about it. And then we have training for parents and caregivers where we invite uh, different stakeholders, experts in different topics like your feeding, developmental issues, positioning from our occupational therapist that we give to parents and caregivers. And then we have community dialogues and advocacy for disability rights that parents get upskilled on, and also facilitators go into the communities and have these dialogues to change perceptions and perspectives around disability. We also do a lot of research in the same program where our parents are also upskilled to collect data within communities. We offer psychosocial support to children and families, and referrals and links for families into different stakeholders and services that are available for parents and caregivers of children with disabilities. So this is the structure of the network and how it works. We have an advisory committee that sits at a provincial level, and then at district level, we have what we call network parents. And then we have our parent champions, who are all the parents that are within the network. So all the what our the network parents do is they go around the communities, they identify families of kids with disabilities, share information, and also get them to join the network for support, more support that they might need. And through the advisory committee, which is our board, this is where the parent network will bring issues that are within the network that they think need to be addressed, or areas within our communities that we feel we are able to bring in some change, or programs that can benefit parents of kids with disabilities. Thank you. Next slide. So the method is that our network parents who sit at our district level would identify families of kids with disabilities within communities, offer peer support, and these parents are upskilled with skills to facilitate dialogues within the communities, to shift perspectives around disabilities, of course, and also upskilled to do field research data collection within the communities. Next slide. So far as we see it, the network has grown across nationally in South Africa. We have about 1.2 to 1.4 parents that are in the network, and just over 800 of parents and caregivers that are active. And I just put in a few messages from some of our network parents who Mari said, when coming to provincial groups, I have learned a lot and met a lot of parents with the same challenges as me and ideas on how to handle our problems, this is the goal of the network, for parents to be able to support one another, help one another with information and resources as and when it is needed. And Cleopatra said, for me, I can say that it has been a great experience to be part of the network, especially it gives me an opportunity to open doors for other parents whom once felt rejected or felt scared to go forward while caring for a child with a disability, which is one of the major goals of our network, of course, to ensure that parents don't feel isolated in the caring of their kids, and information and resources. At least there is a link from families to communities and resources within the department and those that are within their reach. Next slide. Please double click on your left there. There's a message. Just another message that I took from the group from another parent to show the support that we are trying to get from parents SPS supporting one another. A parent shared that she went to a dentist and she was informed that the toothbrush that is suitable for a CP or related CP child is a nylon with bristle brushes inside and out. At the same time, then other parents were thanking her and asking where they could get the same resources. This is the type of support that we see, and the network is trying to get for all the parents that are within the network. Next slide. So we have done a few studies within the network. This is one of the studies that we did, and I thought it is important for our webinar today, this particular one, which was a comparison of the out-of-pocket cost borne by families of children with and without disabilities in South Africa. And as we can see, we have over 70% of unemployment rate for caregivers and parents of kids with disabilities. And for obvious reasons, parents of kids with disabilities need to be more at home. They spend more time away from work, which compound most of these challenges. The challenges that they face are financial difficulties due to unemployment. If they are employed, they have to spend more time taking their kids to health appointments and other appointments for their kids' well-being. And all of those compound the financial difficulties. Access to healthcare. Most of our parents are in outskirts areas, in rural areas, and transport to go to these healthcare services is a challenge. And school exclusion. Most parents don't even have information of where their kids can be placed in terms of education. And if they are having such information, they still stand on long waiting lists within our government systems for their kids to be placed within school systems. And more than all of this, stigma around all of these challenges has become worse and is the biggest challenge that we faced when we work with our parents and support our parents, because some parents result into just not doing most of these things, not looking for school. You find a child that is like 15-year-old who has never been in an education system, who has never been in an ECD, because the stigma around having a child with a disability in our outskirts communities, it's so bad that parents don't even want to be known within their communities, and you end up kids being excluded from all of these services due to lack of information and empowerment. Next slide. So I wanted us to also meet one of our parents who also became now a parent network coordinator, Mashia Kwadi, who is a mother of a child with Down syndrome. I think she's also joining us in a webinar today. She thought, okay, you can share a bit of my story as well. Mashia has said that before she joined the network and ultimately joined Shona Quip as a parent network coordinator. She felt so isolated. She did not even know the information that she knows now. She didn't even know that she could take her child to school. The boy is now developing and she can see a lot of progress since she has taken him into an inclusive ECD center, and she is very thankful for the program. Next slide. So in conclusion, our parent network support to isolated caregivers who are unable to access information and services has been one of the goals and is still one of the goals. We are still looking to get more parents into the network. We provide and connect and emotional support through our psychosocial services. We have a team of social workers that sits in the network that support and pick up on issues where, as and when parents share. when there are issues that parents can support one another with, and the psychosocial team sits in the network and they're able to early intervene. And it enables us to the parents to have access to training sessions and peer support as we have mentioned. And we have bi-weekly training sessions in the network that focuses on a wide range of topics, mental health, kids' developmental milestones, self-care for caregivers, and many other different trainings from different experts. And it ensures effective referrals and access to services for caregivers and their children, and has empowered caregivers to be able to advocate themselves for inclusion. At the beginning of the network, most of the support came from our team to the network itself. But as we see it, parents are able to support one another, support each other through advocacy. They're able to accompany each other for services uh, within different service providers in our government institution. So this should be one of my second last slide. Uh, we are still reaching many other parents, trying to reach as many parents as possible out there. That is our QR code. If you want or know any other caregivers of kids with disabilities that would want support, would want to be part of the network, please pass on the information. All they have to do is scan the QR code. If not, there's a WhatsApp number on that poster. They can just text the WhatsApp number, and one of our parents, who is Mashia Khwadi, who I introduced earlier, the parent network coordinator, will be able to add them into the group. And yeah, next slide, please. This is my last slide. Thank you so much for the opportunity. I really appreciate it. And let's get the word out there for the network. It's available for our parents and caregivers. Thank you so much.
Thank you, Awelani. All right, Charles, maybe you should just go ahead and do your presentation.
Okay. So welcome everyone to this webinar. I am Charles Okello from Makerere University, Child Health and Development Center in Uganda, and I'm here basically to share to you evidence from a home-based grown program here, and we hope that you're going to learn from this program, this Parenting for Respectability, that did embrace a disability inclusive approach. Next slide. So at CDC generally is with a mission basically to promote the well-being of children and women in Uganda. That's the big mission of CHDC, and we basically do this through carrying out multidisciplinary and multi-sectoral research, where we look at research ranging from all sorts of life, for example, malaria, and all other issues. There is also teaching and training, since it's from Makerere University, and then this is accomplished, of course, through several partnerships that the department has established with the help of the university with other partners. And the institution started way back in 1989, which was in response to the research on HIV/AIDS. But ever since then, the research angle has really evolved to encompass issues such as even parenting, which is our main subject in this webinar. So I really want mostly that one on the third slide to talk about the adaptation and piloting of the Parenting for Respectability program. which is a test study that we're basically trying to test the feasibility process and lessons from Uganda. Next. Um, Existing evidence basically in Uganda shows that there is an urgent need for inclusive and targeted interventions for children with disabilities. And in Uganda, the National Planning Authority found out that 5% of children with disabilities are the only ones who access inclusive education, are leaving out a huge number of a lot of others. And on the same note, 1.7 million children with the areas of 2 to 17 live with disabilities. And that is recently found in the census that we did have last year. And on top of that, also, there is a prevalence rate of about 13% of children with disability. That means that when, in general, when you are when a mother will have to give birth, it means that there's a chance of the prevalence or of that happening is like disability is about 13%, and that is really a very high number that really can't go unnoticed. Um, on the same note, next slide. The Disability Inclusive Parenting Program, that is an adaptation of the main Parenting for Respectability program, basically builds on the successes of the Parenting for Respectability program that between 2014 and 2024. The PFR program was able to achieve a reduced violence against children and spousal violence. Though we also realized that we have to take note of that, but not it was not specifically tailored or designed to needs of parents with disabilities or raising children with disabilities. That is what gave birth to the Disability Inclusive Parenting Program or project that we established and tried to pilot in Uganda. So the main objectives of this study were um, basically to adapt and test the feasibility and adaptability and acceptability of the Parenting for Respectability program. Wanted to see that if we adopt this PFR program, how will the communities receive it? And since none of that, we didn't have a similar study that had, been done in Uganda. So also it seeks insights to inform the development of culturally sensitive and digitally responsive parenting interventions to foster an inclusive environment for parents with disabilities. We realize that we need to come up with a program that is locally based that can be there and stand in for, to get all parents with disabilities. We're not specific on a particular disability. We target as many disabilities as possible, since we aim to develop a program that is going to work out through the whole country. So this program had a number of stages. We did a policy review that to find out what the policy in the country really talk about parenting a child with disability. So in this, also had in this word, at that stage, we did stuff like district launch of the program where we tested this, we did launch this. We also had stakeholder engagement. We interacted with relevant stakeholders who work actually in the disability sector and even other parenting arms in the country. Participants, of course, in this we did a lot of activities as you've seen in this slide, such as we had to come up with facilitators who definitely helped us to run this program because we wanted basically to have the communities or people with disabilities themselves um, teach themselves the best possible. So we did this in a number of ways, such as the in-person delivery, where we had the 7 sessions, and we did this over 3 months. Then also we had the WhatsApp arm and the SMS delivery arm. Also, we did the 7 sessions, but then we found a way of fragmenting them to meet the delivery using the technology. Basically, we wanted to have a good reach of all parents, including those who were far away from what our site. We wanted to see how workable is this. Since we want to, well, the main intention is to embed this into a fully fledged inclusive parenting for respectability program. Because we thought that for it to be cost effective in the long run, if we run these things independently, can really be very tricky. So there are pictures, basically trying to give you a picture of how this was done. So this research study was basically we had a qualitative arm where we collected data at 3 endpoints. That is the baseline. We had even like process data and then the endline data. And we gender disaggregated the FGDs, that's focus group discussions, whether we put men alone and women also different. And all this was done throughout the 3 arms of delivery, at baseline till endline. We had the key format interviews and then also process data. Our participants generally included fathers and mothers. That included, of course, those who were biological and non-biological. As long as someone was caring for a child with a disability, we also took charge of them. We looked at older and young adults, I mean, young parents, young women like 18 and above, of course, in Uganda, since the constitution doesn't recognize 18 and above as what? There were those who were married, divorced, and even grandparents. So we had a lot of participants in this study.
Charles, sorry, we're going to be running out of time. Can you just tell us the overall experiences of the program and the main issues that came up around the involvement of parents of children with disabilities?
Okay, let me quickly jump to that. So let's go. I'm going to slide.
And Charles, you can just talk to your experience if you want.
Okay. So basically, the issues that arose, we realized when we went to the field, there were a number of issues that really came up. To begin with, we had a lot of stigma, and this has been highlighted even in other presentations. These parents are stigmatized. You get to realize that the community doesn't want to associate with them, and even sometimes the stigma extends even to their own partners. You find that, for example, women with disabilities in most cases were not so much included by their husbands. They would only come home at night and they would definitely leave all the responsibilities to the children. I remember in Moscow there was this particular lady who stood out to me. She had this child who had bowel incontinence, and she didn't really have the diapers to help out the child and to make sure that the child was in her teenage years. So this mother was so concerned, and what really stood out was the government was really didn't have that in place. And we really hoped that through carrying out this study, we are going to, of course, we have published some manuscripts, and that will, in the long run, will what influence policy. That's basically what stands out in our study.
Thank you so much, and good morning, everyone. It's wonderful to be here. Thank you to the other presenters for the helpful presentations. Just going to get my screen sharing right. There we go. Can you see the presentation well?
We can.
Wonderful. Yes, so today it is my pleasure to just share a little bit about our journey of coming to grips with disability inclusion in the parenting programs that we work with a specific focus on the digital and blended digital parenting programs. We'll dive into a little bit of detail of what we are currently engaging on for Parent App, or Sinoweo app as it's known in South Africa, just to give you an insight into the questions that we're asking. We are really early on in this journey. We're not as advanced as the Parenting Perspectability team yet, but we're grateful to all the people who've gone before us as we venture into this really important subject. So at Clowns Without Borders, we have been working for many years with our partners in the Global Parenting Initiative, including Parenting for Lifelong Health, the University of Oxford in Cape Town, Items International, and many other partners to co-develop evidence-based parenting content. And what's really exciting is the diversification from in-person parenting support to digital and blended digital interventions, because we use the same evidence-based content, which we continue to pilot and test with universities, but it's delivered at a fraction of the cost. So the implementation cost is reduced to as low as $6 or even 77 cents with the digital interventions, from the initial cost of $120 per family for these programs that were delivered in person. So that really provides exciting opportunities for scale. The digital and blended interventions are still very much designed for low data contexts, and they're free for users to really take away those barriers for participation among the families that we aim to target. And they're adapted for local cultures, for contexts and languages. And what we try to do is we always tailor the content to the needs of the users and the child. Now that brings up the question, what is needed among the parents and the children that we are targeting? And a group of parents and children and families that is often overlooked is families with disabilities. Even though they have more complex needs and vulnerabilities, or maybe because of it. But the problem is that we don't have a good understanding of the scope and scale, also specifically in the South African context. So there's a lack of reliable statistics, but we know it's relevant for many families. In South Africa, we have very limited census data. There is an underrepresentation. Census data only shows disability for children over 5, for example, and there's a lot of late diagnosis. So some families will not be captured in these statistics. So the official statistics is that we have a 7% prevalence of disability among children over 5 in South Africa from the most recent census. But Shona Quip, who is also presented, has done an alternative survey among 21,000 households that showed a much higher prevalence, which really emphasizes the need to support these families better. Now, what does that look like if you want to consider disability inclusion in parenting interventions? Of course, you have to consider the children with disabilities, but also the parents with disabilities. And then there is a whole range of disabilities that we need to including physical, cognitive, communication. There's different things that come in for different kinds of disabilities. And it all starts with better understanding what parents and families need and what their realities are. So that's what we've been trying to do this year, trying to engage in conversations with organizations of people with disabilities, as well as with families, to better understand what is needed. So our very, very initial explorations have shown some cross-cutting issues that we can see. There are a lot of financial challenges that come with disability, high medical bills, parents not being able to work or work as much because of care needs, additional costs of transport. There are behavior management challenges. Access to services is a really big struggle for a lot of families with exclusion, acquiring assistive devices, understanding their rights to care. There are a lot of challenges around personal care for the children that are being looked after, around the diversity of matters. There's a lot of stigma and bullying when it comes to families with disabilities. And of course, parental mental health is under a lot of pressure. So we see a lot of stress and burnout and a lack of support for these parents and families, which is why it's so wonderful to hear about this range of initiatives that we've been hearing about today, including these parent support networks. But what we see from this mapping is that some of these parenting needs are universal. As Shona from Shona Quip loves to say, a child is a child is a child. A child with a disability is still as much a child as any other child. But there are also some unique and specific needs of these families that we need to look into. And all of the challenges that we map, they're exacerbated by the lack of information or by misinformation, exclusion, and stigma. So that emphasizes the need to make sure that when we improve disability inclusion in our interventions, disability needs to be both mainstream so that the general population, if you like, can also gain better understandings of these realities, but there's also a need for tailored support around the specific challenges of these families. So to give you a bit of insight into the specifics of what we're trying to engage in, at the moment we are strengthening the online safety component of Parent App or Synovio app, really diving deep into what the online safety risks and opportunities are for younger children and teenagers, understanding that better. And with that lens, we've also engaged more with BPOs like Shona Quip to understand what is needed there. So we've realized again that there are some content needs that are very similar to other families. So things that have been identified is that it's important to mobilize the parents first because they're such an important protective factor in the family. We have to start early. So as soon as children engage with devices, they need to be guided on that. And there's a need for repeated messages around safety to ensure that learning and retention among both children and parents. Similar kinds of core safety rules came up around how to protect your child when they engage online. And there is a need for support around sexual development, both in the general populations as well as with families with disabilities, where we've seen the specific need to emphasize that children with disabilities experience puberty and urges like all teens. So again, it's a cross-cutting issue that we can raise awareness on through the parenting work. And then we need to promote open and non-judgmental communication. So really keep that kind of supportive parent-child relationship, strengthen that, and use that as a foundation to guide our children well. But of course, there are also some specific content needs, some specific needs around design and delivery. Some of the other speakers have already mentioned those as well, using accessible formats, including visual representation of families with disabilities, and then also creating dedicated sections to respond to their support needs around specific safety tips, referral information. And there's a strong need for peer support, sharing experiences with similar families on how to navigate challenges. And the key messages need to be that children with disabilities benefit from digital connectivity, potentially even a lot more than other children, because they might be more excluded in the communities and school. So that benefit is very important to emphasize. And safety comes through education and communication, not through avoidance or taking away technology from these children. So those are some of our very initial learnings that we've done with the app. Now, what we realized in that process is that this is not a quick fix. This is not something that where you have a quick look through the app and add a few pictures of someone in a wheelchair and say that this is now disability inclusive. Something more needs to happen. So we are currently engaging in a two-step approach. We're first doing the service level adaptation to strengthen disability inclusion. So that includes a review of, if you like, low-hanging fruits, like what are the key things that are easy to change to already start mainstreaming disability inclusion, which includes some initial co-design with families with disabilities, including the parent network that Awelani was sharing about. And then we want to apply for joint additional funding to do a thorough review and co-design. So that includes a closer look into the evidence of what parenting support for these families looks like, further co-design with representative families across provinces, across disabilities, across settings, also including these organizations again, as well as government for continued buy-in into the process, which enables scaling. And then we want to integrate both cross-cutting adaptations and those tailored add-on components that these families need specifically. And all of that, of course, comes alongside further evidence gathering so that we can keep on improving what it is that we are offering the families in South Africa and beyond. So a big thank you to all of our funders as well as we engage in this journey. And if you would like to try Parent App, you can scan the QR code at the bottom here to explore a web version or download it in the App Store or in the Play Store.
Okay, let's move on to the presentation by UNICEF that will be presented by Ida Ferdinandi, and you're going to present your own slides. So thank you.
Thank you. So I'm just going to put this in full screen mode and hope that you will be able to see it. Is it okay?
We can see it, but it's not on full screen mode. It's not
Oh,
on presentation mode, but we can see it.
okay. Is it better now?
Ah, that's perfect.
All right. So thank you so much. So I'm going to present to you the adaptation of the Parenting for Lifelong Health for Young Children program for parents of children with developmental delays and disabilities. And I will begin by explaining the rationale for developing this new program. So first of all, we had a lot of success with the original Parenting for Lifelong Health for Young Children program. And here on the slide, you can see two publications that you can find online, which speak to this success. The first one is a feasibility study, which we did almost 5 years ago when we were scaling up the program. And the second one is a journal article in Prevention Science by Professor Judy Hutchings, myself, and a group of other authors from last year, where we sort of presented the developments after this feasibility study and the ingredients for success. However, ever since the beginning, we have noticed that around 9.7 parents of children who participated in the PLH program in Montenegro had a child with disability, and they did not necessarily target their child when taking the program. And in fact, we told facilitators not to encourage parents to do so because we knew that the program wasn't adapted for parents of children with disabilities, but we cannot be sure that they didn't do this in the end. And our facilitators told us that this program needs to be adapted to better respond to the needs of parents of children with disabilities. We also had government buy-in for the adaptation, particularly by the Ministry of Education and the Ministry of Health, and also support from the European Union to proceed with this work. I also wanted to flag to you that the second rationale for the adaptation is the ongoing initiative to reform the early childhood intervention system, which is currently taking place in pilot sites, but we are expanding it geographically in collaboration with the government. And here you can see a document that is available on our website. It's a situation analysis of early childhood intervention, where you can see that not only are our children with disabilities identified late, they're also underserved. And the predominant model in Montenegro is the medical model, where mostly you have one-on-one treatment of the child by an expert, a therapist, and the parent is not involved waiting in the corridor or wherever and feeling completely disempowered, picking up the child, taking the child home and not knowing what to do with the child, and just feeling that they have no control over their child's development. So this new approach is mostly based on home visits and cross-sectoral collaboration, but we don't have much time to go into the details. I just wanted to say that basically this new model is compatible with the PLH program because of the idea that you are working with parents and empowering parents to parent their child. And we thought that the group-based parenting program is an excellent complement to this individual home visiting program because we know the benefits of working in groups, and also considering that this program in itself has, these basic parenting principles that are applicable for all parents. So when we combine these two, we have the new program, which we called Together for Caring Families. So here you can see that the content of the program combines the PLH for young children 12 session. I have to highlight we are still sticking with the original 12 session program and the Enhancing Parenting Skills program, which is an individualized UK-based program developed by Professor Judy Hutchings to help parents of children with a range of severe development behavioral challenges. And it's a home visiting program, sort of one-on-one program. So we combined the two. Also, it's important to highlight that our adaptation is designed for parents of children aged 3 to 9 with ADHD, ASD, or language delay. We just heard from Anna that, there's a range of disabilities, so we decided to sort of focus on these challenges because I think this is where our parents sort of struggle the most because it's about communication, where parents sort of really have the biggest challenges. The program has the 12 sessions, as I said, but also 2 individual home visiting sessions that take place before the group sessions. And the first one is sort of the traditional one where we get to meet the family, introduce them to the program, pose a set of questions, demographic and outcome questions so that we can do a post questionnaire. But the second visit is more tailored and it's about getting to know the child, getting to know the parents and the challenges they're facing so that even though this is a group-based program, the facilitators can sort of tailor the program to the maximum extent to the individual needs of the families. It emphasizes social learning theory, individualized goal setting, just like the original program, but also it has a bigger focus on looking after yourself. Again, we heard from previous speakers that parents of children with disabilities are under a lot of stress. And then also it has more focus on attention, how to engage the child, how to develop communication, and also functional assessment of behavioral patterns to enable parents to understand the reasons for their child's behavior. So now moving to implementation. So we had 2 pilot cycles so far. We had 5 groups in spring 2025. So this year, we had 47 parents. It was delivered by primary healthcare institutions and kindergartens, and some other specialized education institutions, so all government. Then we're running 2 groups now in autumn. They're implemented by our health centers, and 15 parents have been recruited. Our facilitators were trained in March as a 2-day add-on course to the 4-day PLH training that we normally organize. And we had a mix of experienced and new staff, meaning that we had facilitators who had delivered the original program, multiple times, and then they took this training and started delivering the new program. But we also had some who had just been trained in the original program before taking this specialized training, and this was their first delivery. So now I'm going to move on to the results of our formative research, where we wanted to see the feasibility of this program and sort of the preliminary outcomes to see whether we should proceed and scale up. And it was a mixed method study, qualitative and quantitative. So here you can see on the slide some demographic data. I'm not going to read it because of lack of time. And you can also see that attendance was quite good, not as high as in the regular program. However, it was still good. So we had the mean 7 sessions out of 12. When we combined group and individual catch-up sessions, we had an average of 9. And completion was also quite good. We had 77% of parents who completed, and those who completed had very high attendance. And so 34 completed, 10 enrolled but dropped out, and 3 did not enroll at all. So this is how we come to the overall number of 47. But the pre and post questionnaire was filled out by the 44 parents who enrolled, so they attended at least one session. So I'm going to move on to the results because we don't have much time. So really, really quickly, you can see that the child outcomes were that we had significant reductions in hyperactivity and emotional problems, significant improvement in prosocial behavior, overall SDQ total difficulties reduced from borderline to normal range. Peer problems remained unchanged and still in clinical range, and there was no significant change in conduct problems, but they were not being reported at baseline in the first place. When it comes to parent outcomes, you can see here improved positive parenting practices, supporting behavior, setting limits, significant reduction over reactivity and total dysfunctional parenting, stress levels and depression significantly reduced. We were very happy to see this. And also another outcome was lower acceptance of physical punishment as discipline. We also implemented a satisfaction survey where 90+% of parents reported children's behavior improved, 95% found parenting skills useful, 97% reported playing more often with their children, corporal punishment decreased, and 100% rated facilitators as very good or good and would recommend the program to others. So now moving on to the qualitative study where we had interviews with 10 parents, and here you can see some quotes. So basically, parents reported being able to break certain patterns of behavior, such as automatic reactions of anger or punishment towards their children. And this, as a result, led to the reduction in frustration among children and decrease in aggressive behaviors on the part of children. The parents also found their children becoming more independent, which is great. Also, some parents said that their partners were not very supportive of their participation, their spouses. They were not so supportive of their participation in the program initially, but when they saw the results of the program in the house, they became really supportive and even started sort of copying the parent who attended the program, trying to implement some of the principles. And also parents really highlighted how this was so important for them, how the program made them calmer, and allowed them to understand the importance of me time and sort of their entitlement to me time, if I can say that. I really like the third quote, if I could just read it. So I was constantly questioning whether I was doing the right things with my child. Most of the treatments my child attended were one-on-one, and I cannot be involved. This, meaning the new program, was an opportunity for me to learn something myself and really engage in the process. I mean, this really just illustrates how this medical model is really just leaving the parents so disempowered and frustrated, and how these new approaches that bring, they're sort of the center on the family, is what the parents need. I also wanted to highlight some barriers to participation because you could see that 10 parents dropped out, and we also didn't have very high group attendance. It was good, but not as high as we had hoped. So basically, these were the barriers. So illnesses of family members, the need to take children to treatments in other cities and abroad, which is the result of the very underdeveloped medical model-based system in Montenegro. Then the difficulty in arranging childcare during the workshops, particularly for single parents. And this really highlights the importance of establishing additional support mechanisms for future implementation of the program, because these are parents, as the previous speakers have said, that have, complex needs, and they really need a range of supports. Now I'm going to go very briefly over the focus groups with facilitators. So, as I said before, we had the experience of engaging both experienced facilitators and new facilitators. And the experienced facilitators who had delivered both programs, the original and the new program, were comparing the two programs. And interestingly, they had recruited into the new program some parents who had attended the basic program. So they could also compare the two programs. So this is what they said. They said that parents who had previously participated in the standard program demonstrated a significantly higher level of interest and engagement in the new program. They found the content more relevant and tailored specifically to their needs as parents of children with developmental difficulties. There were more open in communication group discussions, and compared to the basic program, they felt more recognized, more understood, and more central to the content and group process. The facilitators also highlighted the extreme importance and benefit of these home visits. They found them very useful, important for building trust, which is essential for this kind of programs. And also they provided insights into the family as a whole. However, they also did say that the program was more challenging to implement, more demanding, and, the home visits took more time. And so this is just something to take into consideration. They also said that it's better to have smaller groups when delivering this program, the adapted program. They found setting limits part of the program more challenging, and they felt that there was no need to add additional sessions to the existing program structure, but rather to consider reduction of some content so that there's a greater number of illustrated stories and more concrete examples from parents' everyday lives. So in conclusion, I hope I didn't go over my time. So in conclusion, the feasibility study showed strong positive effects for both children and parents. It was accepted as relevant, useful, and empowering for families. The results and feedback suggest a need for some adaptations, and this is ongoing thanks to Professor Judy Hutchings, who's working hard on these adaptations now. We believe that the program is justified for further development and wider implementation, and our next steps, which we're now discussing with the Ministry of Health and the Ministry of Education, is how we can train more facilitators and support further scale up in 2026. And this is just the list of references in case these slides will be shared with all of you. Thank you so much, and I look forward to your questions, if any. Thank you so much for this opportunity.
Thank you, Ida, for that really interesting presentation. And thank you to all the speakers. And now it's open now for questions and comments. I think, Mahi, people can put their hand up, or you can type in the Q&A. So while I wait for the questions, I think what's really interesting is the importance of the peer network and the support, where often parents of children with disabilities are left to their own devices and feel very isolated, and that then increases the burden of care on the parents as well. So this kind of peer network that the Shown-Equip project shows us is so important. And then also about that you can't just do the regular mainstream parenting program, you really do have to adapt it to make sure that it addresses the needs of the parents. And maybe do we have any hands up, Mahi? I can't see any, and there's nothing in the chat so far. Oh, what I wanted to find out, and maybe Elaine or Awelani from Shown-Equip can help us a bit with this, is what are the additional things that parents with children with disabilities face in terms of parenting? What are those crucial aspects that make it difficult for them to cope as parents? Awelani, do you want to start?
Yeah, thank you, Maggie. I think most importantly, the themes that have come out from the network, I am so sorry. I think somebody has decided to cut some grasses outside. If there's some background noise, please. I'm
That's
sorry
fine.
about that. Yeah, but I think what we have seen mostly is parents just feeling like they are not doing the right thing, just not knowing what to do in terms of how to raise and help their kids develop as adequately as they can. That theme has come up a lot in most of our trainings, and you find parents that just feel very stuck and not know where to turn to for help. And I think what is very important is just to remind them that there is just never a right way, not with just any child, not just kids with disabilities. And we understand that it's just far more difficult when you have a child with a disability, but there's just never any right way to do it. Parents more often feel that what they are doing is just not adequate. They could have been doing more to assist their kids. They should know more, but information is just not out there readily available, or the people that have the information are just not accessible enough to the parents. That is one theme that I think has come up a lot, where you just feel that parents just feel like they are just not doing enough for their kids. They want to do more. They want to be able to assist their children. They want to ensure that their kids get the services they need. They're able to get into ECD centers. They're able to get into schools. They're able to be as independent as possible. And they feel it is their responsibility to ensure that there is a level of independence in their kids' life. But they just feel that they are just not doing enough. Yeah.
Thanks for that. Elaine, you want to?
So I was just going to add to, because I absolutely agree. Just, having information on hand. I also feel that there's a lot of information. Well, there's a lot of the professionals don't actually have accurate, up-to-date information on specific disabilities. A lot of parents feel very alone, which is one of the biggest challenges. And then also they don't always reach out because we have this culture just generally globally that if your child is misbehaving, it means that you're a bad mom or a bad parent. There's also this culture that if there's something, especially in South Africa, if you have a child who has a disability, some cultures believe that you did something wrong. You often blame yourself as a parent. So it's a very, oftentimes you feel very stigmatized, very alone, isolated. And it's one of that I think is the biggest challenge. When you find your group, your community, you feel less isolated and you have then access to information and feel like you're walking that you're walking the path with other parents that are going through the same thing and you feel less alone.
Thank you. We've got a couple of questions in the Q&A. So the first one by, there's no name, it's anonymous. Were there any additional skills that the facilitators needed to be trained on? It's not clear on which program is being referred to, but this would apply to all the projects that are happening. Since the program was specific for parents of children with disabilities, so how do you train the facilitators? Anybody want to respond to that? Those of you who...
Yes,
Ida?
yes. I don't know. I don't know if you refer to Montenegro, but well, we had this add-on training, as I explained. We first had the basic training that everybody had to go through. So this is about the basic principles, collaborative approach, managing groups, all of that. And then this add-on training was mostly about the content and, what are the differences, what are the changes in the content. But we did require from participants who delivered this program to have experience working with parents or children with disabilities. This is really, really important. We found it really important, and for us, that was sort of the criteria for selecting facilitators. And I think it's important to keep it that way because parents really have very complex needs, and they really need to feel confident that they can get support from these facilitators. So I would highlight this is really important.
Thank you. Awelani, do you want to talk about your experience?
Yeah, we kind of have a similar criteria, but then one of the biggest criteria we have is to ensure that our facilitators are parents of kids with disabilities themselves, so that when they go out into the communities, they are able to relate, other parents are able to trust, build that rapport, and it is easier for them as people that already have the lived experiences to share their experiences and actually encourage other parents to participate in this dialogues and trainings and share their own experiences. And more than that, more beside the facilitation skills that are needed, more skills that we required or actually trained parents on was just to ensure that as people that are able to communicate effectively, at least have one language within certain communities that they are training in. For those that are not fluent in English, they're able to communicate in a local language in that location that they are based. Yeah.
Thank you. There's another question about emotionally, how are both children with disabilities and their parents supported? I don't know if anybody wants to, it's quite a broad question from
Please
Charisma Mushi.
repeat that, Maki.
How are children with disabilities and their parents supported emotionally? I don't know if
Maybe speaking from our project or our program particularly, the support mainly go to the parents who we in turn ensures that they're able to support their kids. The parent network is a support program for the parents. In terms of emotional or psychosocial support, we have a team of social workers, I think I mentioned in one of our slides, that are readily available to pick up as and when parents need additional support. We also have different groups that are created as and when a need comes. One of the groups would be our bereavement group, where there is a lot of extensive support from our psychosocial services providers for parents that lose their kids in the process while they're in the network, referred parents that have just lost their babies in the process. So that is the level at which we support them. If there is a need for extensive support, we refer them to other stakeholders like your mental health service providers that are within their communities or that they can easily access, or even within the departments of health and social development, respectively, depending on the challenges that they are facing. Yeah.
Betty, tell us a bit
Yes,
about.
yeah, good afternoon. I'm sorry I joined late. I was in another presentation. Coming from our project, we work directly with the parents with disabilities. So in terms of support, we have organized the parents in groups where they attend the parenting sessions with facilitators who are also themselves either parents with disabilities or parents of children with disabilities. So there's always a shared understanding about how they feel about the situation they find themselves in, how they relate with the content which we have actually tailored to address their different needs. So a lot of the parents now feel that they are comfortable enough to come out and talk about the suffering, about the stigma, especially the stigma that they feel and the isolation. But now, in terms of beyond the program, we don't have a clear referral pathway yet. And there are very few organizations in our context that are dealing with children with disabilities and how to support them. We have met a lot of challenges around meeting the expectations of these parents in terms of material needs, in terms of financial, a lot of things that are still left pending. But above all, they feel that the groups have empowered them enough to feel not alone with disability and parenting children with disabilities. Thank you so much.
Okay, Ida.
Sorry, I was muted. Yes, So for the adaptation of the PLH program in Montenegro, we have added some elements, but the original PLH program has, a lot of components that relate to emotions. Managing emotions, emotional support. What is specific to this program, the adaptation, is that there's a whole session, which is the first session for parents which is about them taking care of themselves because they are under a lot of stress. And it's very important to have this as the first session because they all come to the group with so many emotions, and it's hard to move on with the program before they actually get to vent and get support from each other. And then they can finally move on and be constructive. It still has a session naming emotions, just like the original program. So parents also, they're supported how to support their child, to name emotions, manage emotions. And there's some specific elements, for example, calming strategies, teaching children calming strategies when they're under stress, what they can do to manage their emotions and calm down. So there's a lot of things. There's a mix of things, but we found very good results with the original and this new program. So I think there are ways that we can do that. But just like the previous speaker said, we're working directly with parents, not with children, but we're supporting parents to parent their children. Thank you.
And there's a nice comment by Kutwano Matlu in the chat, and I just want to read his last point. Honestly, it's a lot. He's a parent of a child with disabilities. It's a lot, and we need counselling. We just didn't have enough information how to access such help, and I think it's a cry. There is one last question around anything that we need to especially consider for parenting programs for younger children, younger than 3 years old, with disabilities. Any quick final comment on that from none of the panel? It can also be answered in the thing. Awelane, quickly, a quick comment.
Yeah, I think for kids younger from 0 to 3, I know this has always been a big challenge, like proper diagnosis at that age. It's such a huge challenge. If you do notice or query that your child might be having any developmental delays, I think what I would advise is to ensure that you get into the system, ensure that the child does get a formal diagnosis so that a child is able to access services that are available, and we don't delay the child further into their development. Thank you.
Thanks. And Elaine, last quick comment.
I agree. Access to early intervention services, having a database for the different services that are available for early intervention. But I also just wanted to, and I know that the time is running out, but I just wanted to touch on the previous question regarding support for parents and their mental health and children. How do we support them emotionally? Well, there is a lack of experienced people to be able to support persons with, specifically from our field, persons with intellectual disabilities. And we are looking at collaborating to be able to put together some resources for therapists to be able to support persons with intellectual disabilities, because there is a huge need. So I just wanted to share with that.
Thank you. And there's a final comment came on from St. Kitts and Nevis asking for access to these types of support programs and training. So if anybody on the panel wants to just answer that question on the Q&A, that would be really appreciated. We've come to the end of this webinar. Thank you very much. It's been a really good attendance at it, and we really appreciate that. We really apologize for the technical difficulties. We did try out everything before, and sometimes these things are just bigger than us, and we can't always manage them. But thank you very much, and thank you to the presenters for putting your stories out there and telling us about this really important area, about how do we make sure that children with disabilities have the parenting that they deserve, that they can then be able to develop into fully participating, included adults in the society. Thank you.